So if you look globally, there are about 5 million individuals who are corneal blind or have significant visual impairment due to loss of corneal clarity. If you look at where those people live, about 70% live in Asia. So as a corneal transplant surgeon who wants to be able to help colleagues globally address corneal blindness, this is why my focus is in Asia. One of the first places I went to was Aravind Eye Hospital. That was in 2008. That's the year in which I established a nonprofit called Visionaries International that has supported my international work ever since. This, of course, is only possible through the generous donations of many of the donors who have supported our work internationally. And to date, we've conducted about 70 skills transfer courses. These are courses that usually take about a week or so in length, where we go to a hospital in a country. Typically, we are working in Southeast Asia, where we will give lectures, do demonstration surgeries, hold wet labs, and then assist local surgeons with performing both basic and advanced forms of corneal transplantation. I think we've conducted skills transfer courses now in about 15 different countries. There are some countries, though, that I've been to more often than others. I've conducted now 17 skills transfer courses in India and 20 skills transfer courses in Vietnam. So while we've been to many different countries, we focus on those in which we feel that our impact is the greatest. I've been privileged to interact with colleagues there in those countries to teach them different forms of corneal transplant surgery and to learn from them regarding management of these conditions that often I don't see as often in my practice. One of those conditions is called congenital hereditary endothelial dystrophy, or CHED for short. Dr. Ramappa is the world's expert on this condition. He's at the Aldave Prasad Eye Hospital in Hyderabad, India, and I had the privilege of visiting him just a month or so ago. Even in his hands, which is the experts, he's reported that a good percentage of these transplants fail within 10 years after transplant surgery. So it underscores the need to develop new approaches to treat this condition that don't require human tissue that has increased risk of rejection and failure in a pediatric population. Because we know the gene that is deficient in this condition, we can actually look at ways of replacing that gene in the cells of the cornea which is missing. And so I am the principal investigator on a preclinical trial of using adenoviral gene therapy for treating congenital hereditary endothelial dystrophy. And so my visit to Aldave Prasad Eye Hospital to visit Dr. Ramappa was more for me to learn more about this disease, to see infants and children who are affected by it, talk with the parents about what does it mean to have an infant or child who cannot see, who doesn't meet their developmental milestones. For those who have had corneal transplants who are doing well, fortunately to hear their stories, but also to talk to those families whose child has had a transplant who has not done well, and then to gauge what would their interest be in coming to the United States for gene therapy for this condition. And it was a remarkable visit and has inspired in me even more motivation to move this study along.